Everyone, this is Grace Walker, the Cafe social media coordinator. I'm hosting this evening for the Cafe series, Ask Your Doctor. And with me this evening is Dr. Astril Webb, and she's going to tell us a little bit more about herself, her profession, and her relationship to the Cafe community. Welcome, Dr. Astril Webb. Nice to have you here with me. Thank you for being with us.
As always, Grace, it's always a pleasure to speak with you and to be able to share on the Ask the Doctor series. So I am grateful and thankful. So in terms of me professionally, well, I am a medical doctor, as some of you may already know, but I am really in the space of doing training, consulting, and coaching. So I provide those services for other health professionals as well as businesses who have employee wellness programs attached to them, as well as the general community, because there's so much in prevention when it comes to healthcare. So just educating people about physical and mental health, right? So that's important. And of course, I am a proud Cafe parent of 2 kids, actually. My son LaSalle is going to be a senior this year. So this is his last year through the program as a student. And then my daughter, she's a sophomore currently in high school. That's Solella. So yeah, so I'm really grateful and thankful to be part of this particular forum for several reasons, of course.
Well, we are so honored and appreciative that you can take the time, because we know that, especially now with all of the demands for key health concerns, service, and your expertise, great need at this time. Let's just go right into thank you. I want to say for our last contact with each other, which began on a year ago when we did our first interaction, and you shared again all of what the concerns were as we approached the COVID crisis and how it was going to impact our kids. And for the audience who's looking at it, you can see that video on the Cafe Youth.org YouTube where we had our first session. So please go to the Cafe Youth.org YouTube and please subscribe so that you can be up to date with some of our current interactions like this. What has been the occurrences in your experience now, a year after COVID onslaught hit our populations as well as our kids especially?
I will tell you, and I think everyone knows it now who didn't know it before, mental health is definitely a mini pandemic amongst COVID, right? And in our fight and our hope for getting some kind of adjustment to this new norm, we're seeing that so many people are more open to talk about their mental health challenges and to really get the help that they need, or people are actually surfing the internet now, finding the information. It's probably one of the biggest Google searches right now, dealing with mental health and overcoming depression and anxiety. So we see that people are more vocal, where we didn't talk about mental health very much. Because of the stigma, I think we're seeing people actually trying to get the help that they need. So as we, when we look at our children, there's an enormous amount of anxiety as they're trying to get back into school, right? Or how can we socialize again? It's been almost a year since, most of our states have gone into lockdown. In fact, many countries around the world, some of them are still in quarantine mode. But we're seeing hope, signs of hope, whenever we get the message that we're getting ready to open. But we have to do it safely. We have to do it cautiously. We have to still social distance and wear masks, or we're going to see an increase again in the number of cases. Though we have the vaccines now and it's still hopeful, we do not yet have the evidence to show us that once you have the vaccine, you're clear of the virus. So we have to put our protocols in place, right? Or we're going to see the numbers go back up and then we're going to start locking things down again. And I think for our children, it's a little unfair because they have been at home for a long time and they almost feel trapped. So they are looking forward. The weather is changing. The sun comes out. We're now having longer days. And so they're looking forward to going back out and interacting with their friends and playing on the playground again. So we have to embrace that. And if we don't want to do the right things for ourselves, we need to do it for our children, right? Because mentally, this has had a toll on them. So I know, you may ask some questions as we move forward, but I do want to highlight that we still also need to monitor our children as they're getting ready to go back out to schools, right? So there are some children that are going to be happy to get back out. We know those are the ones who miss the social connection. But then there are some of them that we really have to monitor and see if they're getting more depressed or more anxious when they're going back out to school. Because these are kids who tend to sometimes be left behind a little bit in terms academically. And so they will feel the challenges as they go back out to school. And then there's another group of students that will feel a little bit lost, and those are the ones who are bullied because the bullying will resurface. And so for so many of them, they may have seen a little bit happy at home. Yes, they want to be with mommies and daddies and grandmas and so forth. But at the same time, they were able to escape the bullying, right? So we do have to still monitor the children and make sure, monitor signs and see if they seem more happy or more withdrawn, because these are just indications that they may be struggling with a mental health challenge. And we would have to address that, especially in the school systems. In fact, so many of our family members may not know where to turn. Some of the schools have resources. So it's really good to identify these issues if the students are getting ready to go back out to school, because then you're in a better position to connect the parents directly with those resources.
Give us your medical expertise on how can we as adults facilitate and help in this process with the introduction to school. Perhaps we're going to have to speak with one of our cafe educators soon to tell us what school life is going to actually consist of. But children are going back into a very different normal. How are we to acknowledge what to anticipate, how to manage this as adults?
I think let's look at it, because we're talking about youth, right? So let's look at it as the ABCs, ABCDE. We'll stop at E. All right. So that would probably be the easiest way to process it. So first, the A is to really acknowledge that mental health is as serious as a problem as a physical health when it comes to children, right? So we have to acknowledge that they can struggle with a mental health problem and know that we need to do something about it. I mean, it's like a child with a toothache, they will go to a dentist. A child who has appendicitis with stomach pain, we rush them to the ER. The same way we have to look at a child who is emotionally stressed out. We have to really seek the mental health professionals, right? And then the B is be knowledgeable about the signs and the symptoms. What does it look like? How do you know if that child is going through a mental health struggle? Do they seem very sad all the time? Are they reserved? Are they always in their rooms? Are they eating well? Are they happy? So there are some signs. Some kids get more aggressive. They get more violent when they're depressed. It's a sign of depression. And then, of course, facing the fear of the unknown. There's some kids who are very fearful. So they don't sleep well at night. They have nightmares. They gravitate to their loved ones, moms, aunts, fathers, uncles, whoever is close to them. And they feel separation anxiety if they have to go back to school. So if we know what some of these signs are, and that child who's not eating very well, or, not eating a lot of sugary foods, they might be close to junk foods. They may be feeling depressed because that's what they do, right? So if we know the signs and symptoms, if we're aware of them, then we can monitor the child. And then the C is consult the pediatrician or medical, any medical professional, preferably a mental health specialist. And the reason why I didn't say mental health specialist first is I don't want us to go around labeling every child who's going through signs and symptoms as though they have a mental health issue. Some of them may be just going through typical adolescence or pre-adolescence. So it's really difficult sometimes if you're not trained to know the difference. It's what you might be seeing is typical adolescence changes and not a mental health problem. So consult a professional. And there are not just doctors and nurses, but they are also nutritionists and peer counselors, that they call them. Some parents who've been through the training themselves, they serve as peer counselors, so they can help parents as well. And then the D is to develop support systems for the children. So if you believe that there is a mental health issue arising, think of family members and friends who can be there to support this child, because it's just like if you have a medical illness, you develop this support system around you. These are the people who will pray for you, encourage you, say kind things, help whatever the needs are, if it's preparing a meal for the family. So these are your support systems. So we develop those support systems, and we make sure that it's available. And on that list, not only are we including family members and friends, but we're also looking at the professionals, programs in our communities, Zoom, programs that you can access. So all of these are part of the support system. And then the E would always be encourage the message that hope is possible, right? That recovery is possible. And if we keep promoting messages of hope and recovery, then it gives that child, it gives that parent the hope themselves, as a parent, that I need to be present for my child. This is not, well, they're struggling with a mental health problem, I don't know what to do, I throw my hands up in the air. That's not how it will work. And of course, we want our parents, grandparents, guardians to be aware you don't have to have all the solutions, right? There's a community around you that can provide some of those. So never feel embarrassed to reach out and share that, a child is going through these struggles, but rather the more open we are, the more people can share their resources and let us know, where to go. Oh, by the way, this doctor is awesome. And, or this cafe program is maybe a great place for this child to be, even though it's virtual. So there are creative ways that we can help the kids, but people won't know if you don't really share. And if we do share, it should never be for gossip. It should always be to improve the life, the well-being of that child. So those are just some, ABCDE, if you remember those, it's a good start.
Those were key functional, fundamental ways of understanding how to craft your own response to each of the ABCDEs that you shared with us. What are some of the key steps for parents who are concerned that their child has or may have a mental health disorder?
Yeah, and the first step would be, if you're concerned, please contact your pediatrician. They are taking virtual appointments as well if you can't go into person. But, you can also let them know you're concerned about the mental well-being of your child. Now, if they will ask you certain questions, and if they determine that the child is in danger to themselves, feeling suicidal or, cutting themselves or so forth, they may refer you to the emergency services. if they need to, for in a case of an emergency. However, most kids aren't necessarily at that level. So they should be able to still get an appointment in with the pediatrician. And then that person, based on the child's age, will do a referral, either to a mental health provider, or they may consider a mini mental health status evaluation. And like I said, there is some kids are going through pre-puberty or in the height of puberty. And so, they can determine whether or not these factors or the symptoms they're expressing are attributed to that. But also remember that we are coming through a pandemic. Our children have not had the opportunity to really talk about how they feel about all of these changes coming at them. And neither have they been in an environment where they may have been getting the help they need. So they have not yet learned how to open up. And this is one of the things I'm hoping that teachers will do. And I know programs like Cafe will do. We have to put a focus on mental health in our programs and our services with our children. Because if we don't have a way of evaluating it, a child can be bottling up these ill feelings, and later on they can explode, in which case we call it a crisis. And no child should have to go through that. And I think it's time now for us to kind of pay attention to those. So even as parents, you have to pay attention and monitor your children. You know them best. And I know for some parents, it's almost like, okay, if I can get them focused on something else, less for me to work about. But the truth is, it's still your child. So we have to be engaged, and we have to still pay attention. So those are just a few of the steps that a parent can take.
One of the things that Cafe, in doing this series, is going to not only facilitate, is to have the audio recordings of each of these sessions in a second language, and the most common language that we have in our communities at this point is Spanish-speaking community. And so I was going to ask you, in terms of, again, there are so many cultural stigmas that are associated with mental health. And without me presupposing what they are, as a parent at a time when my son was in high school, or during his pubescent years, there was a lot of ADD discussion, and a lot of parents had to become very aware of that. During this pandemic now, as you're saying, the crisis of even suicidal behaviors has been heightened. And again, it's a very frightening concern for most parents. But in those cultural homes, there may be even harsher realities that aren't being addressed. How do we speak to that?
You are very correct when you mention cultural differences. I think it's important for us to understand, because of the stigma, right? Most of the times it's a stigma. Even in the Caribbean culture, the Hispanic culture, the Native American culture as well, we are not as open to talk about mental health issues. We're not open to talk about our emotions and our feelings about things. So we have to, as parents, because everything is being translated, so that needs to be the message as well. Mental health is real, and we need to address it. We cannot push it under the rug. We cannot ignore it for our children. We need to learn how to talk about it. Now, there are some issues that are taboos in that home environment. So even if we're teaching the kids, how to open up, it may not be welcomed by necessarily everyone in the family. So, as a Cafe parent, or a parent who's watching this recording, if you're a different culture, please understand that your kids are now being empowered to really share about their feelings, about their emotions. So it's not it may be initially uncomfortable, but with time, you will understand that it will be in the best interest of our children to really talk about these issues. And so one of the issues that we see in many of the homes is actually abuse. It's very difficult. I'm talking about verbal abuse, emotional abuse, and then there's physical abuse. And our children are witnessing these things, and it will have an impact on them. So we have to understand as well, if it's happening within the home environment, then we need to address those issues as well, because our kids are being impacted. One of the other things that we see in many of these other cultures is a high amount of drinking and drug use. These are real issues, and we cannot ignore it. I see everyone who's, struggling with an addiction as someone who's hurt. Hurt people, right? And you've all heard that expression before. So sometimes that person is really hurting themselves and they need help too. So we have to try and find ways to help the adults in the home, because the children will just model this behavior later on in life. And it's going to be difficult for them to cope too with situations. So, and the other challenge that we have is that, those addictions can drive physical behaviors that aren't, comfortable for other family members. So we have to talk about those issues and address them as well. And I think one of the beautiful things about Cafe is that we're open to talking about real life conversations, where conversations that are true and authentic with the children. We won't sugarcoat it. We will deal with difficult situations head on, because together, then the kids get the help that they need. It's just like a difficult problem or assignment. Sometimes we don't know how to figure it out. We don't know what to do, but we rally around as a group. And if there's somebody else in the group who can give insight to how we solve the problem, then that's what we do. And the same way we have to do it with our emotions, with our behaviors. It is a village. It takes a village. And I want every parent to know you're not alone. If you need help, then just let the staff at Cafe know. They are all, most of them are trained to really identify mental health challenges or emotional, or they know where the resources are. And so utilize them as a resource to get the help that you need.
This has been such a formative exchange, and there's so much more that we need to share, but we can only do so much in our given time. And I want to again express that what your contribution is to not just our Cafe listening audience, but to all of the audiences who are going to hear this and to see this on our channels, is the opportunity to look at a brighter, hopeful, and more healing situation as we course from our current situation to introduction to school regimes, and practicing what we continue to do is best of health care and mental health, especially for all our loved ones. Would you lend a closing remark to our audience?
First of all, since we're talking about mental health, we have to let everyone know it's okay to talk about our emotions, our feelings, our ideas, our behaviors. And if we're going to change any of it in a more positive way, we have to deal with it, right? So we have to be open about our feelings, because if we openly talk about it, then our children will learn how to openly talk about what they feel. And if they do that, then they can get intervention at a much earlier age. I mean, research has shown that the earlier the child talks about the issues, the better the outcome is for them. And that is what we want for every child, regardless of where you are. And so, a program like Cafe is helpful, but if you're not in that environment, that community, then you can also connect with your local health departments, mental health departments for your various communities and in different countries. They're all available now. So please reach out to help for help. You don't have to have all the answers. You just have to know that hope is possible. Health and recovery is possible, and the help is available. So if we have that mindset when it comes to issues of mental health, then every adult and every child can have a chance to overcome some of these mental health challenges, or at least learn how to adjust and cope with them.
May we ask you, Dr. Webb, and I will include this as part of video, if there's any collateral that you would like to share, white papers or links to what might be available services, particularly in our communities, please, I will include those as part of our listings. So it will be again available to our audience and to the public at large.
Absolutely. So, and if you need, I will share a listing of various services with you. But if for any reason you're having trouble finding them in your community, feel free to reach out to us at healthykinder.org, and we will try to connect you with the resources available in your community.
So we will include your link,
okay.
healthykinder.org, so that our audience members will have an opportunity, if there is a need to, or even if they just need follow-up information, there is a source that they can reach out to. Thank you for presenting that to our audience. Again, Dr. Ash Webb, it has been a pleasure talking with you. So much information that is helpful to all of our audiences, to all the parents who are listening, and to all the children who are going to be going back to school. Looking forward to everyone having a very successful transition back into our different norm, but certainly going to be met with whatever challenges there might be. We will meet them head on and maneuver through this all successfully. Again, it's been a pleasure, and so much thanks to you on behalf of CAFE, the management, and all of our staff and family. We appreciate your time, and you're taking the time to be here with us, Dr. Ash Webb.
Thank you very much.
You're welcome.